Hello, this is Dr. Hughes. This video is about the importance of adopting a healthy lifestyle if you have heart failure. Let's talk about smoking. Smoking damages your heart. Each puff of tobacco raises your heart rate and your blood pressure, and you'll have less oxygen in your blood. Smoking also leads to clumping or stickiness in the blood vessels that feed the heart. Because heart failure is all about moving the blood and oxygen around the body, anything that interferes with this is a bad idea. Aim for a smoke-free lifestyle. And if you're smoking now, try to stop. People who quit smoking are more likely to have their heart failure symptoms improve. What about daily exercise? Well, exercise is important in heart failure, but always check with your healthcare team first before starting an exercise program. Your doctor or nurse can help you find a program that matches your level of fitness and your physical condition. If you exercise on a regular basis, your tolerance for activity will increase and you may feel better. The goal is 30 minutes of exercise 5 days a week, although you can break up the 30 minutes into 3 10-minute sessions if you want to. Let's review. What is the exercise goal? The goal is 30 minutes 5 days a week. What about blood pressure? Less than 100/80 is ideal. And blood pressure is the force of blood pushing against the blood vessel walls. High blood pressure means the pressure in the arteries is above the normal range. If you have high blood pressure, this is usually treated with medication and by reducing your sodium. And we've already talked about the importance of eating less than 1,500 to 2,000 milligrams of sodium each day. If you have not watched the sodium videos, make sure you see those. Other things that help keep blood pressure lower is maintaining a healthy weight, exercise, cutting back on excess alcohol, and of course taking your medications as prescribed. There are a number of other topics related to having a healthy lifestyle that we could cover. For example, having lower cholesterol is important. For total cholesterol, less than 200 is desirable, and high cholesterol is usually treated with medications and by reducing the amount of saturated fat that you eat. In addition, some people want to lose weight because excess fat increases your risk of having a heart attack and having other health problems. However, if you're overweight and try to lose weight, don't try to lose more than a couple pounds a week. These topics are really beyond the scope of these short videos, but we bring them up as part of an overall strategy for staying healthy. Any of these topics, smoking, activity, blood pressure, cholesterol, and weight, any of these can be discussed with your healthcare team for more information and more ideas on staying healthy. Our point here is that adopting an overall healthy lifestyle will help you to have the best quality of life that you can have with heart failure. Thanks for watching.